What if the thing you've been told will make you a better clinician is not the thing that will actually sustain you? Dr. John Oberg has worked across medicine, business, behavior, and AI, and what he's learned is this: if you keep chasing knowledge without learning how to think, connect, and meet people where they are, you may look successful and still miss what matters most. If you're a pre-health student or early clinician, you've probably been told to focus on grades, research, productivity, and the next step. You've done that. But here's a different, deeper skill set no one is really teaching you. And in this episode, we will unpack what that actually looks like and how it leads to meaningful success in medicine. Dr. Oberg, thank you so much for joining us on Shadow Me Next today. You have created this absolutely incredible resource specifically for people with chronic disease. And we are going to talk about that, but we are also going to talk about so many other things that are really interesting, hot topics. Really interesting hot topics, a little bit that you shared with me so far. So thanks for being here and thank you for joining us.
Yeah, thanks for having me. I have no idea where we're going, but I'm excited to go.
It's a blind drive, but I'm driving, so don't you worry, you're in good hands. Let's first talk about your journey into medicine. I would love to hear about what first drew you to the profession, how you decided on your role in medicine.
Yeah.
Maybe start there for us.
So I think I joked that I started in medicine when I was 8 years old. My mom was running a medical practice. My grandfather was a surgeon, and I got sick and had to stay home from school, and I had to go to the office and file charts. And so I was like, oh, getting sick and staying home from school sucks. So I don't want to do that anymore. And like by the time I was like, when I was 12, there was no HIPAA. I was like processing x-rays and like watching the film dry. My hand was in chemicals that probably would like today be so against the law. And I'm like looking at people's x-rays with the doctors, there's no HIPAA at all, right? So that was my start in medicine. I don't think that was probably the best start to medicine, but I was pre-med in college and I got pretty turned off. I was on the bench biologist. I was working in an HIV lab and had a pretty bad experience with the lab director where there's things going in the lab where somebody else was messing with somebody else's experiment, and I called it out and they were like, so what? And I was like, I'm not going to do that anymore. So I went into business and decided like I studied biology for a bit. I really wanted to go, and so I took a detour into the business world and I started running companies, and so I started starting companies as a serial entrepreneur, and then I got into a place where I was consulting back into the healthcare world on the business side of things. And then all of this was based in like psychology and, how do you go through change management and all these types of things. I was pretty deep into like organizational psychology. And then my mother-in-law got sick and she had type 2 diabetes and had a really bad experience with a really good doctor, frankly. So the doctor wasn't the bad experience, the system was the bad experience.
Yeah.
And so the doctor was frustrated. You've probably experienced this. The patient, my mother-in-law was pretty unhappy. And so I said, okay, I'm going to go back and get my doctorate at USC and I'm going to solve this type 2 diabetes problem. And everyone's like, that's cute. Type 2 diabetes has been a problem for a while. You can come try to get a doctorate, but just so you're aware, we've been working on this for a long time. And then in our first pilot study, we reversed diabetes in 49 out of 50 patients in 12 weeks. And in our second study that's not yet published, we're in the process of publishing now, we took 79 patients with an average A1C of 11, a minimum A1C of 9, and reduced that into the low 7s within less than 6 months, took 30% of our patients off of insulin within 6 months, like just ridiculous results.
That's amazing.
Pretty fun. Fun, huh?
I want to tap into those numbers real quick too, because most people, well, first people might say, what's an A1C, right? And then second, they might say, well, what's a normal A1C? So define those values for us real quick.
Hemoglobin A1C is measuring how much glycation is happening for your red blood cells in your body. And so in a normal healthy body, it's below 6.5 for most adults. If it's above 6.5, you have diabetes, right? And so it's generally tracking your average blood sugar over the last 90 days. Close enough, right? And so if you're above 6.5, you have diabetes. If you're under 6.5, you might have prediabetes. If you're under 6, you're pretty healthy. And so when you've got a 7 or an 8, you're in pretty bad shape. And so in our first study, we had an average A1C of 9.6. And then if you can drop that A1C percentage from like 9.6 to 8.6, or from 6.5 to 5.5, 1 percentage point in a year, you've got $1 billion drug. We generally drop A1C by 1.5 points per month.
Outrageous. And this is not necessarily with drugs. I mean, people are going to say, yeah, they must be on GLP-1s or GIPs or any of that stuff. you're not necessarily using that. You're using something in totally different, which we'll dive into. I don't want to tease it too
Yeah,
hard
yeah, for
right
sure. Yeah. Yeah. Yes, and.
now. Before we get too far though, filing charts. This is going to be another great segue, right? So once upon a time, when we were
Yeah.
dipping our hands into, actual chemicals to process actual film of x-rays, once upon a time, we had paper charts and we had
Yeah.
to file them. And it's a great
Yeah.
conversation I just had recently with one of my medical assistants. And he said, Ash, what did you do before you guys just had electronic health records, EHRs or EMRs, electronic medical records? And I said, well, we had stacks and stacks and stacks of filing cabinets, and you'd have to
Yeah.
go and pull the charts. And it's just so interesting because I think it really highlights your career in medicine. For when you started, now we're joking about it. You were 8 years old. I was a medical
Yeah.
assistant myself when I was filing charts, not a practicing clinician, but to something we're going to talk about, which is AI healthcare solutions. And this is
Yeah.
brand new, right? So you have traversed this incredible journey really in healthcare to see some impressive advancements. And I'm sure some pretty miserable fails as well along the way, right? It'll be
Yeah.
a really interesting conversation. Like I said, I do want to tease it just a little bit, but
Sure.
I'd like to first talk about your transition in college from working in that HIV lab, having a bad experience, and deciding that it would be an appropriate time to pivot. And then you did find huge success as a businessman as well. Let's speak directly to our students right now who are maybe in a similar boat, right? They have this dream of healthcare and they think something has happened. I'm having to make a big pivot. I'm really scared. Was it hard for you to make that change?
For me, I've always tried to like keep the right doors open. And
Mm,
so it's like and I never try to like make decisions that'll close lots of doors. So it's like,
mm,
I think and early in my career, I had some mentors who were like, what skills do you need to build to open doors? And so those skills could be, clinical skills, they could be business skills, they could be people skills, which are really underrated in today's world. And with AI happening, those people skills I think are going to be more important as we go forward. So I
mhm,
think, so what I try to do is, and I take my kids through an exercise, like my children, like in 10 years, what do you think you want to be doing? Okay,
mm.
I promise you're wrong. No big deal. What are the skills that you generally have to develop to go in that direction? And let's pick one or two,
Oh,
right? And
that's
let's just pick one or two
great.
skills. And so sometimes it's about, I like to talk to them about learning how to learn. Like, do you know how to be a good learner? And then learning how to connect with people, because those two skills I think are going to be the most valuable in the next 10 years for people, is learning how to be a good learner and then learning how to be a connector, like how to connect with people at a human level. I think those are going to be two of the most valuable personal and professional skills going forward. That's my social worker talking.
I thank you, social worker talking, because that's exactly what we need to hear right now, especially people going into medicine. We're already having conversations about what elements, and I'm just talking about the medical world here right now, what elements of medicine is AI going to replace? These are real conversations. I'd imagine as a student right now going, well, am I going to have a job? Am I going to have a job when I get out of school? Is this something that I should even be considering? So
Yeah.
these people skills, I think they call them soft skills now, but it's just they're going to become very, very not soft skills
Yeah.
here pretty soon. They're going to be distinguishing skills for certain
So
people. So,
funny story about that. Hard skills and soft skills were
mm,
defined by the military a long time ago, and
mm.
finance used to be considered a soft skill because you couldn't touch it.
Are you serious?
Yeah.
I did not know
Now
that.
hold on. I read that on the internet. I didn't fact check it with all of my scientific libraries, but it makes sense, right? And
It
so
does.
I
It
think I
does.
think soft skills, one of my favorite stories to tell people is not a true story. It's a fictional story that I made up, but it's a good story. I
Okay.
tell people that if I wanted to give my wife an iPhone for Christmas because she wants that, and my daughter wants the same iPhone, if it were true, which it's not, that my daughter wanted me to wrap a present and tie the bow myself, and my wife felt like the wrapping paper was bad for the environment, don't use it at all, and I gave them each other's present, bad soft skills, they'd both be angry at me for giving them exactly what they wanted,
Right.
right?
That's so
And so it's
true.
like, yeah, so it's like I've got to be like, soft skills are the ability to package a message in a way that someone's able to receive it,
Hmm.
right? Like that's
Hmm.
so anyway, I can go geek out about that forever.
Oh, well, I love that. I think that's fantastic. We could do a whole TED Talk, which you have done before, but we can do a whole TED Talk on that exact topic. And, maybe we will. Maybe we'll have to circle back and do that one day.
I love
But
it.
um, HIV lab in college, there's a lot of questions right now about research. And if we want to go to med school, a lot of times you need research. If you want to go to PA school, you may not necessarily need research. Did you find in your experience, aside from the bad experience, was research really formative for you? I mean, did you feel like it was necessary step for you to take?
Here's what I think is great about research, and I think the same thing can be true for like engineering. It taught me problem solving. It gave
Mm,
me some early mental models about how to approach a problem objectively, and then how to challenge assumptions and be okay with bad assumptions. I think sometimes today, when people get things wrong, they sometimes is this sense of shame or blame or guilt along with a bad decision, versus, hey, the way we move the scientific world forward is we make a null hypothesis and then we test it to try to disprove it. And so failure is a part of the process. It's like, and so
mm,
you get this, you don't tie up the outcome with your identity psychologically, which is really, really important. So I think that you can get that in the hard sciences. I think you can get that in engineering. I think you can get that in some of the liberal arts too, if it's done and taught very well. I do
mhm.
think that it's probably systemically harder to get in those other disciplines than it is to get in the hard sciences, because you can iterate so quickly, or in engineering where you iterate so quickly. So I had to take classes in physics and in calculus and in, all these classes that everyone who's listening has to take too. And you guys have all taken those same classes and
Yes.
probably liked them as much as I did, but I learned a lot from it. And I think that learning is the important part.
You are dropping so many incredible just gold nuggets here. Failure is a part of the process. You are absolutely right. And, to walk around all day and say, well, I haven't made a single mistake, it probably means, well, you haven't tried a single thing that was new, right? I mean, you haven't
Well, that
tested
is the
any.
mistake. Like
Yes,
that's
there
the
you go.
mistake. Like what have you learned? And the key, my mom passed away, but she was so great in so many ways. And she said to me at
Oh,
one point, she said, I tried to make sure as you got older that I kept you away from the cliffs, but I let you take on more and more of the larger potholes. And so I think that's such a great way of letting people learn. And so when I instruct people in the college classroom, what I try to do is keep them away from the cliffs and learn how to identify the cliffs, but let them navigate the potholes through experiences so they can learn experientially.
and that builds resilience, right? I mean, there's no better way to be tested than to experience those potholes, to experience those major kind of upheavals where you say, whoa, that didn't feel good. That wasn't right. We need to go ahead and
Yeah.
navigate around that next time. Absolutely incredible. Okay, let's talk about AI in healthcare because I'm very, very
Yeah.
excited to chat about this with you. Can you give us a snapshot for our pre-health students and our clinicians? Can you give us a snapshot of what AI healthcare solutions? What does that even mean? And why do we need to be interested in that?
We're using AI in lots of places. In fact, there's a large company called Salesforce.com that has 135,000 companies using their platform. We were the first company in the entire world to roll out two of their specific AI agents because of the way that we handle AI. And we were
Mm,
really fortunate to be able to work with them as a partner and do that. And so I think, so we use AI a little bit on the patient facing side, a lot on the clinician facing side, a lot on the administrator side. AI is really great for taking highly repetitive tasks and helping them, or tasks that require massive amounts of information, and
hmm
making them happen better, faster, or cheaper. And so I tell CEOs of organizations, like, if you're not thinking about AI agents as a part of your organizational chart going forward, that's probably not a good idea. And
hmm
if you're an executive in a company who doesn't understand how to deploy AI onto your organizational chart, you're probably going to be at a competitive disadvantage. In the same way that people who didn't adopt personal computers were at a disadvantage to people who did, or people who didn't adopt the internet were at a disadvantage to people who did, or before that, people who didn't adopt calculators were at a disadvantage,
Yeah.
right? Like, so we go back to that medical practice where I was filing charts. There
Right.
were people on typewriters taking dictation machines and like transcribing notes from doctors' dictation all day long. That was their entire job. So
Wild.
that job doesn't exist anymore. And so there are changes in how people, what jobs people do and how they do it. And that's just, I
Mhm.
mean, if you look at sociology over the last, let's call it 10, 20,000 years, change is a part of what we're meant to do. Like, that's
Mhm.
just the evolutionary nature of a society. And so we're in a place right now where we're going to have some inflection points. And so again, what I try to help my family see is like, what does the future look like and how do we get ready for that? And I think embracing AI in the same way that you embrace a calculator or a personal computer, but that means you still have to learn how to critically think.
Hmm.
Because if you just take information from a calculator and you don't recognize when you missed a keystroke, your calculator is going to be wrong because you missed a keystroke, right? Or if you take a computer and just start typing, like, so I think there's like, these are tools, not human replacements today.
And honestly, I would love for you to kind of reframe that a little bit in your expertise, which is with chronic disease, right? So if we are
Mhm.
not using our brain, if we're not using our critical thinking for a long time, chronically, oh, what I reframe that for us. What is that going to look like?
Well, let's just take the words eustress and distress. Like those are two words that don't often get used on two sides of a coin. But
Hmm.
eustress, EUSTRESS, eustress is positive stress that builds you. Distress is something that breaks you down. And so if you use that analog in the muscles, we know that we have hypertrophy and atrophy. Muscles that we build because we've lifted weights, and atrophy that goes away. Or we can have distress in muscles where we tear a muscle because we've overused it.
Hmm.
Well, that same thing exists emotionally. That same thing exists cognitively. And I don't know
Hmm.
that we have all the same measures we do with muscles in those areas, but we're learning that the analogs are pretty true. And so, if you stop working cognitively, you tend to decline. And that's why people tend to die, give or take 5 years after retirement, broad scale generalization. But
Hmm.
if you stop working your brain, you tend to pass away, and that's not a good thing. And
Hmm.
emotionally, the same thing. Like if you don't engage emotionally with eustress and distress, you're going to lose some of your ability to engage with things emotionally. Physically, we know that's true. Like any of the functional medicine, and like you can look at any of those parts of the world, and we're showing that longevity has a really important physical component to it, and also emotional and cognitive. So at the end of the day, you should be lifting weights for your muscles. You should be lifting weights emotionally, figuratively. You should be lifting weights cognitively. Like all those things matter.
Hmm. Hmm. Absolutely. I want to talk about something real quick. And that is, somebody listening might be thinking, this guy is he's a cool science nerd. He worked in an HIV lab and he was talking about all those crazy A1C numbers. And he's using all of these cool words like eustress and distress. But then you are framing this in a very emotional, personal tone as well when you talk. And that brings me to your podcast, which is Tales of Abundance. It was born out of a near death experience. You were talking about cliffs and potholes earlier, and I had to bite my tongue. But tell us a little bit about this podcast. How it was created, and then why our pre-health students should be listening to this.
It's super cool. Like it's a place to go to feel good. Like I think in this world, there's so many things that are just like, I look around and I'm like, man, that's like, ooh,
Hmm.
and how do I engage? What do I do? And I know I want to be a part of it. And part of that is I just want to put some good stories into the world. And so
Hmm.
we go and we talk about like what's happening in AI, what's happening in finance and cryptocurrency and medicine. But like, what are the cool, fun, like we just talk about stories. Like, one of the guys I work with is a former Catholic priest, and he talks about like what is it? What they're talking about giants in the Bible? What's that all about? Like just
Wow.
fun, cool, uplifting, like feel good. Like how do you find abundance in your life? And whether that's abundance with your family, or
Hmm.
abundance with your fitness, or abundance with your finance, or with your friends, or with fun. We use 5 F's, right? So we just talk about abundance in all those 5 F areas, right? Because there's good F words too. Fun is a good F word, right?
It's a great F word.
So it's like we talk about abundance in all those places. We talk about travel and places we've been, and mistakes that we've made. And
Hmm.
so it's just
Hmm.
a fun place to come and listen. There's 3 different hosts. Most of us are there most days. Really different perspectives on life. Like we don't agree on everything, but you can see that discourse happening like on the
Amazing.
air. And it's like, and we've been friends for a long time. And so we get into it. And sometimes we're like, ooh, that was maybe a little too much for the listeners,
It's a
but
little
you guys will,
spicy.
yeah, you guys will be fine.
How fun. And I think it is so important. Well, I number one, I wanted to highlight your podcast because it's an incredible podcast. But number two, to really showcase the fact that you are a person, not just a clinician, right? Not just a CEO business owner, not just an entrepreneur. You want to live abundantly as well. Your life is not all those numbers that you rattled off. And it is so important to maintain that because that is how we preserve ourselves after
Yeah.
retirement, right? Our life, hopefully, is not going to be our jobs. And if your life is your job, I am so happy for you if that is what makes you happy. But for the majority of us, we also need some type of either a
Yeah.
creative outlet or a physical outlet to go to. And then, of course, the flip side of your coin is Priscina Health. I would love to talk about what you guys are doing there because it is as you mentioned already, it is really truly changing the face of how we approach healthcare, specifically chronic disease.
Yeah, I think for me, that was that going back and getting my doctorate, working with my partner, Dr. Dustin Williams, who's a physician.
Mm,
And, he's the medical genius behind the medical side. I work on the behavioral health side. And what we found is that if you look at all of the medicine, all of the behavioral health, all the administration, all the social determinants of health, if you look at everything in a new light, you actually can reverse type 2 diabetes with
mm,
great efficacy. And we do it all the time. And so, we have people that are really sick and have been sick for decades that
mm.
come to us and are like, yeah, I've tried everything. It's like, well, they haven't tried us. And then 12 weeks later, they're in a really good place. And so, people ask, like, what are you? What kind of company? We're a medical practice. We're literally a medical practice. And we are all telemedicine. We
Mm.
help, California, Texas, Florida, like, we're in like 10 states and we're growing by state as we go.
Wow.
And our thinking was like, how do you help the people that have a hard time getting help? So it was designed with like low income, rural, hard to
Wow.
access communities was how we
Mhm.
designed our entire program. And you mentioned earlier, like GLP-1s, like we'll use GLP-1s, we'll use GIP, we'll use any of that
Mhm.
stuff. But our
Mhm.
first study, that really impressive 49 out of 50, all we used was insulin and metformin.
Wow.
So just,
Wow.
drugs that were only generic, right? And that's how we got that result. And so, like, and we talk to doctors, like, we can geek out after the show and I'll tell you like whatever the clinical, like we can get into this, and doctors and PAs are like, whoa. Like, I have medical officers of major payers we explain the whole process for like finally somebody who gets it. And it's like, yeah, because I took years breaking
Yeah.
down everything that doesn't work. I said, what if it had to be true that it worked for the patient, it worked for the provider, it was financially sustainable for the society? What if all of that had to be true? How would we do it? And that's how we built it. And it's been so much fun to hear the patients. Like, I mean, I was working with a marketing firm about some of our messaging, and they said, send us some success stories. And
Mm.
my COO sent over a list of like 92. They're like, this is our last 90 case studies where patients have said things about us. Let us know if you want more.
It's incredible. And you mentioned at the beginning that your mother-in-law really was not failed by the clinician. It was really good, a really, really good physician, but failed by the system. And it sounds
Yeah.
like that's really what at Priscina Health, it's really what you're trying to fix here. Can you tell us what that means?
Yeah, I mean, look, I think a lot of people would say that our healthcare system is broken, and I'm not going to disagree. But as a social worker, we look at things like at the macro level and say, yeah, the
Mm,
system's not good. But we also look at the micro level. And so my answer is like, there's things you can do individually, even inside of a broken system, to help you help yourself and grab that agency back for your own health. And it's okay to do that. It can both be true that the system's not built for you and you can succeed in a broken system. And so we teach our patients how to take agency back for their healthcare so they
mm,
can succeed in a broken system. I am working on fixing the broken system. I get that it's a problem. I'm working on it. It's going to take a long time. It's going to take a long time. And so we have a 50-year plan for that, and we hope to get it fixed. But for right now, we are fixing patients at the micro level every single day by helping them help themselves in the things they can control.
mhm.
Right. So we do that by like saying, okay, with all the medicine, with all the mental health issues, with all the food, and like, what's the one thing you're willing to commit to today? And for one patient, it was like, I'll change my coffee creamer. It's like, great, let's do that. And we
Super.
changed their coffee creamer, and their blood sugar was measurably lower, their fasting blood glucose, like 4 days later, because we
Wow.
changed their coffee creamer. Another patient they had early stages of dementia. They were only consuming ice cream and chocolate milk. That was their only caloric intake. Their spouse was like, I can't get him to eat or drink anything else. We're like, no problem. Can we just change which ice cream they're eating? They're like, sure. We changed the ice
Oh,
cream. Fasting blood glucose was down 100 points week over week.
wow.
So
Wow.
it's little tiny things.
That's incredible. It really is. And
Yeah.
you know, what I love so much about that story is that you really have been trying to meet people where they are.
That's it.
And
Those are our words. You found, yes. That's what we teach our team. You found, yes. That's it. That's it.
which is
If
really
I'm gonna drop my microphone. I'm gonna drop
drop
it. That's
it's I could actually drop my mic today. I am actually holding it. It's just, you know, and we're laughing because it is really fun to reach that realization. But I'll tell you, as a clinician, that is a lot harder to do then we say it is, right? I mean, we say meet people where they are, but we walk into a room and we're just so frustrated by the patient situation. I mean, who wouldn't be frustrated by a patient who is only their whole diet only consisted of those two things, right? But we've got to start there, and it requires a lot of creativity on your end, I would imagine.
If I were going to say, like, if there's one message across all of people, whether they're students in medicine or whatever, that meet people where they are, it's so intuitive and obvious, but it's so hard to do. Our society does not naturally help people learn to empathize. And so, like, if that, like, our clinicians, every member of our team goes through an hour or so of continuing education weekly with
Wow.
us. So they get and they get reminded over and over again, like, hey, I know you talked to so and so last month, but you didn't talk to him this month, and something may have changed.
Wow.
Something may have changed. And so it's this constant empathy training, constant. And so, anyway, as you build community, like, there are people that didn't have great community in the last 10 years, and 60 years ago we had great community. So build your community. If you're a listener, build your community. If you don't know how to do it, reach out to me. Like, call me, find me on LinkedIn, find me at the website. Like, we will get you connected somewhere. Like, we believe in that. So, like, let's go.
Build your community. I think that's great. And let's give these students a couple tangible tips for how to do that. You mentioned LinkedIn. I think LinkedIn is a absolutely phenomenal place for pre-health. This is high school or college age or young clinicians to really dive in and start being poured into by people. Yeah. I mean, people on LinkedIn, it's incredible how they're discussing problems, but they're discussing it in a solution mindset, right? They're highlighting and celebrating wins. I think LinkedIn is a great place to start. What else? What do you think?
Here's what I would do. I would say, wherever you are in your life, go find 3 people to mentor who are 10 years younger than you. So if you're graduating from college, go mentor 3 middle school students. If you're graduating from medical school, go mentor 3 undergrads or high school students. Like, but find 3 people to mentor, and you're going to quickly learn what it means to be a good mentee from their perspective, and then start looking for mentors. Don't start looking for mentors first. Go be a mentor first. And a mentor means you don't have your agenda. All you do is meet them where they are, ask them where they want to go, and help them get where they want to go without any bias about where that is, as long as it's not illegal or harmful or whatever the case may be. Sorry, I have to say those things these days, I guess. But help them go where they want to, help them go to some healthy place they want to go, right? And without bias. And so, and then go find some mentors. And when I started doing this, like, it took me a while to find my mentors, but I dove in to find mentees very quickly. And I always try to keep 2 or 3 people that I'm mentoring at all times. And it's the gift is really for me. I gotta say, mentoring people, I'm the one who gets the gift. I still remember I went to try to mentor some middle schoolers when I was a master's student, and I thought I was being this really pragmatic, helpful MBA kind of guy. And this school principal in this middle school scheduled 30 minutes with me, spent 4.5 hours with me, and changed my view of the world in this inner city, very low income school. And I am forever grateful for the time he spent with me to really wring the misconceptions out of my brain that I had. So I went to mentor people, and I got mentored, and it was a one-time deal. And it was like, I remember the walk through his school to this day. And that was more than 20 years ago.
Amazing. And we're speaking directly to pre-health students there, but clinicians, that is for you too. Get with some mentees, get with some mentors. We have to build community. Like you said, it is so important. Guys, to learn more about a better approach to complex chronic disease, improving quality and length of life for everyone, please, please, please visit Dr. Oberg at Priscina.com. That's Precina. And he mentioned his LinkedIn, and that's John Oberg. You can find him there. Dr. Oberg, it has been incredible. Thank you so much for what you're doing. And thank you so much for the amazing little gems that you have scattered throughout that entire conversation for our students.
Thanks.
I really appreciate it.
Thanks, Ashley.